Dr. Chase, what challenges and learnings have you encountered as a third-year resident on the front line of the coronavirus pandemic?
Well, I mean, a lot of things. So I was working on the inpatient medicine floors when this whole coronavirus situation first began. So definitely, I mean, that was really difficult for us. First of all, to be dealing with a novel virus that no one knows what to do. No one knows what the treatments are. So it was challenging. It's hard to see these patients up on the floors, as I'm sure you've all been seeing on the news and whatnot. The healthcare workers are having to wear personal protective equipment head to toe just to maintain their own safety while taking care of these patients, which is a completely new situation for us. So that was definitely challenging. Another thing was, just to see these patients on the floors, they're scared. These patients are actually not allowed to have any visitors at the hospital right now. So that was incredibly hard, just to try to provide the support that you can for the patient while you're in the room, but knowing that they do have to be alone while they're in the hospital.
If you could give advice to current students and recent graduates who have been shaken by this pandemic, what would it be?
All of the current students or prospective students, the most important thing for you to realize is we're learning together on this, right? We are trying to hold each other up and to remain positive. But if you're at home right now and your clinicals are being disrupted, your graduation is being disrupted, or you're someone that was considering going into medicine and then you're seeing this happen, I would say really don't give up. We will get through this. It's going to get better. And, as somebody that's studying for this, you want to help people, right? That's your end goal. So to be able to be practicing in a time where this is going on, I think has been incredibly valuable as a learning experience. So for people that are, looking to go into medicine or are finishing up, you're going to have an incredible career ahead of you. And hopefully we're going to have better treatments for this illness than we have right now. So, I want people to try to remain as positive as possible. I know it's been challenging.
How has the AUC medical school training prepared you for this challenging time?
The training we got at AUC, I think, was amazing. Actually, one of the most valuable things that's really helped me throughout this whole situation, anybody that goes to St. Martin, you're going to be, a lot of people go to a lot of different clinical sites for your rotation. So I think doing that, it forces you to be versatile. You really learn to be adaptable to any kind of situation. And I really think that's helped me in this situation because, in battling a disease where we don't really know what to do, every single day is a learning experience. Every day you're getting new information, new treatments, new studies are coming out. And I think having had that previous experience where I was really forced to be adaptable has helped me to kind of roll with the punches and to really embrace the new information as it comes in, just to do the best we can to treat our patients.
How can we show our support and thanks to those who are on the front line of this pandemic?
So if you're somebody that has, masks, gloves, I know that people, you need to keep a supply of masks for yourself to remain safe. But if you have extra supplies, anything you can send to the hospitals in your area really, really would be appreciated. I know there are people that don't have extra supplies at home. So what they did was they actually purchased meals and sent meals for the ICU staff, for the emergency room staff, for the frontline workers that are in the hospital. And that helps you support your local restaurants. It helps provide meals for those people that are in there working. So that's something else that definitely people could do.
Thank you for those of you watching. And again, thank you, Dr. Chase.